Have you ever noticed that a new medication brings an unexpected change in your body? Perhaps something as personal as how often you need to use the restroom. It is a common experience, and your instincts are often right when you link new symptoms to new treatments. Yes, certain antidepressants can indeed trigger or worsen symptoms of overactive bladder. This is a recognized side effect for some people, and it is important to be aware of how these medications might impact your urinary health. The reason behind this connection lies in how different types of antidepressants interact with the nervous system. Our bladder function is intricately controlled by nerves, and many antidepressants work by altering neurotransmitter levels in the brain and throughout the body. For instance, older antidepressants, known as tricyclic antidepressants or TCAS, can have what are called anticholinergic effects. This means they block the action of acetylcholine, a chemical messenger that helps muscles contract, including those in the bladder. While this effect can sometimes be used to treat overactive bladder, in some individuals, it can paradoxically cause issues by altering bladder muscle control, or it might worsen existing conditions. Newer antidepressants, such as selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, generally have fewer anticholinergic effects. However, they can still influence bladder function in other ways. For example, by affecting serotonin levels, they might indirectly impact bladder sensation or the nervous signals that control bladder emptying. This can lead to symptoms like increased urinary frequency, urgency, or even difficulty fully emptying the bladder. If you are starting a new antidepressant and notice changes in your bladder habits, it is important to bring it to your doctor's attention promptly. Understanding the specific class of antidepressant you are taking can offer insights. For example, while tricyclic antidepressants like imipramine have historically been used off-label for bladder control issues due to their anticholinergic properties, too much of this effect can sometimes lead to retention or other problems. On the other hand, certain SSRIs might amplify bladder sensations, leading to a feeling of needing to go more often. This complex interplay highlights why a personalized approach with your healthcare provider is essential, especially given that many people manage both mood and bladder health challenges. Ultimately, managing your mental health is incredibly important, and antidepressants can be life-changing. If you experience bladder issues while on these medications, it does not mean you have to choose between your mood and your bladder. Instead, it is an opportunity to partner with your doctor to explore alternatives, adjust dosages, or consider strategies to manage the bladder symptoms so you can maintain both your emotional well-being and your urinary comfort.